Okay, lithium toxicity can be the result of either an acute toxicity or a chronic toxicity. When it's acute, usually this is an intentional overdose. And when it's chronic, this is when a patient may have decreased renal perfusion. It can be due to dehydration. It can be due to, very important, thiazide diuretics, NSAIDs, or ACE inhibitors. So there are separate clinical pictures that you want to look for, whether it's acute or chronic. When it's acute toxicity of lithium, there are GI side effects such as nausea, vomiting, or diarrhea. But there's also late neurological sequelae you want to look for, which leads to the chronic toxicity. Basically, the patients will either be on the spectrum from lethargic to agitated, and they can appear very confused. These patients may also have ataxia. They have tremors or fasciculations, and sometimes it can even precipitate seizures. What do we do to treat these patients? You want to give them IV hydration. And in very, very severe cases, you can give hemodialysis, which is actually a very good way to treat lithium toxicity. Now, we all know that there's a big gamut of pharmacological medication for patients, especially in psychiatry, and bupropion, which is a dopamine norepinephrine reuptake inhibitor, or haloperidol or risperidone. These are dopamine antagonists used to treat psychosis. They can also present with neurological symptoms such as irritability or, again, a risk of seizures. But don't forget to look at the patient's history and see whether or not they have a history of lithium use for bipolar disorder or for some mood regulation. There are also anticonvulsants that are used for the treatment of bipolar disorder like lamotrigine or valproic acid, but remember, lamotrigine is more associated with the skin reaction of Stevens-Johnson, and valproic acid can also cause GI symptoms like lithium, but also it's related to hepatitis, pancreatitis, and even hepatic encephalopathy. The big giveaway here is that lamotrigine and valproate, they actually are anticonvulsants, so they decrease the risk of seizures, not increase it like lithium. I'll go over the mechanism action real quick on why ACE inhibitors affect lithium. ACE inhibitors, as a mechanism action, they enhance the tubular resorption of lithium, so you basically just have more lithium circulating in your body than you would if you weren't taking ACE inhibitors. So thiazide diuretics, they are contraindicated in lithium because they increase sodium reabsorption, and this decreases the clearance of lithium and significantly can elevate the concentrations, a very similar consequence to taking ACE inhibitors with lithium.